And we are live. Hello, everybody. This is Sylvie with Boutique. So Sonia, my co-founder, and myself, Boutique's co-founder and myself, we wish you a wonderful evening or afternoon, depending on where you join us from. And this is our pleasure to welcome Dr. Angelica Maria Hernandez. Hey, doctor.
How are you? Hi, everyone.
It's good to see you again. And tonight we're talking about actually a very important matter that maybe not everyone is talking about, certainly not every day, but maybe we should. It's libido. And our exact topic tonight is maintaining libido at all ages during the pandemic. This is a topic actually that Dr. Hernandez came up with when we were browsing subjects that have to do with her focus, which is intimate care and sexual wellness. So this is a topic actually that she sees a lot and more patients, and she sees a lot more with patients every day. And we can actually very easily understand why with all this lockdown and quarantine situation. So before we dive into it, let me tell you a few words about this amazing woman and professional that is Dr. Hernandez. We call her Dr. Angelica, but Dr. Hernandez officially. So she's a board certified OB-GYN, and she currently practices at the Lexington Medical Associates and Smooth Synergy Cosmetical Spa in Midtown Manhattan. Her focus is the treatment of sexual dysfunction, and the treatments that she's going to discuss tonight are available at Smooth Synergy Cosmetical Spa. Couple words before we start the talk. So Dr. Hernandez is going to discuss the available treatments and medications, but she's not going to provide any specific medical advice tonight. If you're interested in treating something related to sexual dysfunction or libido, you talk to your doctor, or if you want to reach out to Dr. Hernandez, let us know and we'll put you in touch. So we're going to get started. But before that, if you want to ask questions, you can use, if you want our website, you can use the bottom right section of the website where you can put a chat. There's a chat we can use, put your question. I'm going to pull them out. Or on Facebook, obviously you use the comment section on Facebook, and don't be shy. It's a subject that everybody sooner or later goes through, and Dr. Hernandez is going to tell you all about it. So she prepared a presentation because some of the words and treatments are pretty technical. So we're gonna actually bring it up, and I'm gonna disappear, and I'm gonna come back at the end of the session when we have the questions. So Dr. Hernandez, the floor is yours, and I'm just putting myself in the back.
Thank you. Hi, everyone. I hope everybody's well, and the families and all your families. So I'm going to talk to you today about maintaining a strong libido at all ages and how to nurture and restore it during COVID. The objectives are to determine if sexual desire is emotional or physical, if the treatment as a person and as a couple, and the medications to treat low libido. So what is libido? It comes from the Latin word desire and a Greek word sexual love. Freud used to say that represents all psychic energy and the driving force of all behaviors, not just sexual. That's the reason the kissing, hugging, cuddling is part of the libido. People common ways say that it's a person's desire to have sex. About 15 to 20% of men and 30 to 50% of women experience low sexual desire. In men, usually happens by age 50, and in women happens during menopause. And the reason is that the ovary produce many hormones, and one of them is testosterone. And it helps with the sex drive. And when the ovary is not producing more hormones, the suprarenal gland start producing or continue producing the same quality of the testosterone, but not the same quantity. So it is a change. What are the possible causes? So stress. All of us have been affected by COVID. Children, wives, husbands, and grandparents. Now the job performance is different. A lot of people have no jobs, and the income and way to pay bills have changed. Now all family members are at home, feel crowded, noisy, messy. People lost many relatives to COVID. and some of them still have many side effects from the disease. What about lifestyle? So we don't go too often to the hair salon anymore. The nails are not done every weekend. No tanning, no Botox, no facial, no massage, no dress up to go out, and no friends coming to your home. So the relationships, if you live alone, now you feel more lonely. If you divorce, you don't have that shoulder that you can share those feelings. If you are in a long distance relationship, you're still lonely, except for the FaceTime that you can talk to this person. What about sex? Some people have sex once a day, once a week, once a month, or once in a while. But maybe now during the pandemic, it could be 3 times a day, 7 days a week, or maybe not at all if you're annoying to see your partner all the time next to you. What about the body image? So if you used to bring homemade food to work and be good with the diet, maybe you're now snacking 6 times a day. And now a lot of people is complaining that they have gained weight a lot since March. If you're now not walking to the train or walking from your parking lot to the office, you're now sitting in a desk, you're eating more than when you walk and spend those calories. The gym are closed or the limited entrance, so it's a big difference. So before, you used to have a dress code. Now it's pajama day all day. It feels more comfortable, but it's not sexy at all. If you're depressed and worry how to pay the mortgage, if somebody's sick at home, you don't want to have sex. Your mind is not that to have sex. So sexual abuse is a scar for life. It never goes away. So some of the events, words, smells make a trigger for the person to remember those events. So we also have to keep in mind that the way that we see sex sometimes is cultural. If our parents or grandparents had told us that sex is dirty, it needs to be done with the lights off, you don't give any suggestions to your partners, or it cannot be done during your menstrual cycle, or it's only with penetration, and you now have a partner who wants to do different things. You don't want to because that person is not educated in that way. It's not because he has low libido, it's just a different way to see sex. So there are some couples who have little children that sleep in bed with them, and it's no good. They need to have a space for intimacy. So they need to lock the door. They need to have, in general, you need to have a day, a week for both of you to watch a movie, have dinner, just have a walk, and then have and spend time together. If your teenager sleeps next to your bedroom and you're going to try to have sex, you're not going to concentrate if you make any noise because you're going to be worried that he's been thinking or she's thinking about what's happening in the room. So just put your music very loud and just have sex. If women postpartum or breastfeeding leak during sex and they become uncomfortable, they have some weight that's still left from the pregnancy and don't feel sexy. You need to find a way to feel sexy, and believe me, men want to have sex. They don't care if the vagina is dark, if it is loose, they just want to have sex. So please enjoy the moment. So in the medical causes, there are many classifications, many definitions, but I think the way that I learn it is very simple. It's 4 big different categories. In order to be a disorder, it needs to be 3 elements. 1 is that it causes distress to the person. 2, there is an interpersonal difficulties. For example, the husband wants to have sex, but she doesn't. So he thinks that she has a lover, and vice versa. If the couple has been married for many years and for the past 5 years, they have no sex, and it's no problem, it is not a disorder. It's just a situation. And the 3rd element is that the symptoms has to be persistent for at least 6 months. So the first one is a sexual desire disorder, and it is a lack of absence of sexual fantasies and desire for sexual activity. Nothing. They don't want to be touched. They don't want to have sex. Nothing. And the most common cause is fatigue, medications that we're going to talk in a little bit about it, depression, low testosterone, high prolactin levels. So the second one is a sexual arousal disorder, and it is an inability to attain or maintain sexual arousal until the completion of a sexual activity. In women, it's called frigidity. In men, used to be called impotence. Now it's called erectile dysfunction, that it sounds a lot much better. And the causes could be diabetes, alcohol, drugs, especially heroin, low testosterone, chronic pain. This is very important. People who have chronic back pain or are in pain for many other reasons, it's very difficult for them to concentrate to have sex. If the person who having pain is at the bottom, it hurts the back. If they are on top, it just cannot perform because of the pain. So sometimes they just in pain and they can enjoy sex. Also with the nerve damage, if there is, for example, men who have prostate removed from cancer, some of them, not all of them, may have some nerve damage and it's difficult to perform. The third one is the orgasm disorder. So in women, we call it anorgasmia, and this is when the woman cannot achieve orgasm despite adequate stimulation. So it's very, very important that is adequate stimulation. So if today woman can have an orgasm, but tomorrow doesn't, it doesn't mean that it's a disorder. It has to happen at least 70% of all sexual encounters. It can be caused by multiple sclerosis, genital mutilations, or pelvic injuries. In men, we call it premature ejaculation. So it's when the man ejaculates before the partner achieves an orgasm or both of them have mutual satisfaction. So it is no correct length of time to define premature ejaculation, but it usually occurs under 2 minutes from the time the insertion of the penis. And it could be caused by nerve damage, obesity, low testosterone, psychological. And the last one is the pain disorder. So one very common is dyspareunia or painful intercourse. And it usually happens in menopause, pregnancy, or breastfeeding because of the low lubrication. Or it also could be caused by vaginitis secondary to an infection or any of those forms of creams that they use for contraception. So vaginism is the second one, and it's an involuntary spasm of the vaginal wall that interferes with intercourse. So dyspareunia, they can have penetration, but with pain. But in vaginism, it is no penetration. And it usually happens when patients are being raped or the fear for women to get pregnant. The other pain disorder name is vulvodynia. It is a pain outside of the vagina. So it's usually at the beginning, the patient feels pain, but then after a while, be able to continue with the intercourse. And it usually happens in the posterior aspect of the vagina, so the side that is near to the anus or the rectum. And the cause is unknown, usually happens with a lot of stress. And the same way that it appears, it usually disappears. And with the treatment is usually medications to numb the area. And the last one is a pelvic floor dysfunction. Usually happens when it's a fecal or urinary incontinence, the organ prolapse, so the bladder, the vagina, the bladder, the uterus or the cervix or the rectum is prolapsing. And usually corrected by surgery or by physical therapy. So the medication, so people are taking narcotics. You usually feel sometimes very sleepy, antidepressant, they lower the libido, antipsychotic medication for hypertension can decrease the erectile length of the time the patient can have an erection or men can have an erection. So the treatment. So both partners needs to be involved in the therapy. If a man feels that there is no performance, they need to look for help and see a doctor. It could be problem with the heart, it could be diabetes. So instead of to buy the blue pill online, they need to see the doctor and need to have a stress test before taking any of those medications. And if women feel that they're painful to have intercourse, and instead of to say no, just go to the doctor and look for some medications. So the same way that you have a day to go and do nails, the same way that you have a day to go and to the gym, you need to have a day to have sex. For example, on Friday, he's kissing you and you are thinking, my God, he wants to have sex. I'm so tired. I don't want to. Then Saturday, it is a movie. You'd rather to be in the chair than to be in the bed because he's going to be cuddling and you're going to think, oh my God, we had sex yesterday. Why he wants to have sex again today? No. If you, for example, you say every Sunday we're going to have sex, You better be ready for that Sunday because he's been thinking about sex from the last Sunday. So then on Friday, you can kiss him back because you know nothing is going to happen. On Saturday, you can watch the movie in the same bed, cuddling, because you know it's not going to happen. And if it happens and both of you are happy, then that's fine. But I don't want you to have been stressed about the situation when you know Sunday you're going to have sex. And that Sunday, you're going to get the best baby doll that you have, a beautiful dinner. You're going to lit some candles. You're going to have a glass of wine or any other, doesn't have to be alcohol, any beverage. And you have to spice it up because life is too short. So what are the treatments? So Femilift uses a CO2 lasers to stimulate the collagen in the vaginal walls. So it helps to tighten the vaginal, and then you can improve the sexual satisfaction. It also helps with the stress urinary incontinence. So when you jump during exercise, when you laugh, when you cough, and you leak urine, that will help you too. And improve the lubrication that usually decreases during menopause. So the O shot or the orgasm shot. So it stimulates the vaginal regeneration by using the growth factors from your own blood. And it helps to stimulate or activate the female orgasm so you can have more frequent orgasms. The P shot or the penis shot involves taking platelets-rich plasma or PRPs from your own blood and inject it into the penis. It lasts up to 12 to 18 months, and it helps to reach and maintain an erection, increase the length and the girth, and it helps men who have lost some sensation. The bioidentical hormones, it could be given to men and women, and it helps in the mental aspect when you forget things, the brain fog that many women complain during menopause. In the emotional, it could be when you become irritable, moody, or anxious. And in the hormonal aspect, is the low sex drive, we use testosterone, and with the bone density and hot flashes, we use some estrogen. So the only two medications approved for the premenopausal low sexual desire at ADI, that was approved in 2015, is a pill that you take at night. It can cause dizziness and nausea, and is recommended not to take alcohol because it can lower your blood pressure and you can faint. If you, from Monday to Friday, you took the pill at night, no problems. And then on Saturday, you want to have a glass of wine, you have to wait 2 hours after your last glass of wine in order to take the pill. The other one is the Vyleesi. It was approved in 2019. It's an injection that is subcutaneous, very small needle, and you can put it in your thigh and your abdomen. It has to be given 45 minutes before your sexual activity. Only one dose in 24 hours and no more than 8 doses per month. And the reason is that you can have hyperpigmentation or darkness in your face, in your mouth or your gums, and in the nipples. And it can also cause nausea, headache, and hypertension. What are the other non-prescription medications? One is the Ristela, that is a plant-based blend that increases the blood flow to the vaginal area, making it easier to become aroused and experience orgasms. So it's a pill twice a day, and patients usually said that after about a month, they can feel the difference. Reverie is a vaginal suppository that it has hyaluronic acid. The same thing that people put creams in the face to stimulate the collagen, the same thing happens in the vagina. And it helps you for the elasticity. So when you have intercourse and you use lubricants, the lubricant helps you to go in and out, but it doesn't help you with elasticity. So when you are dry or you have atrophy, the elasticity is not there. So you feel very, very tight and it hurts. So this is important, especially for women who are contraindicated to give any estrogen, like people who have a history of breast cancer. And the other non-prescription medication is Regio Cream. There is a tripeptide made with algae that hydrates, prevents irritation, and helps to protect the vulva and the vagina. Questions?
Okay, that was very informative. So you had a lot of reactions, actually. I'm going to show you a couple here that you were right on spot with this at the beginning of the explanation and the introduction and the what libido was and all. So I thought it was Totally interesting. Rosa, my mind is not on it. I just don't have the desire. So does any of this medication help with like, I don't know, re-kicking the desire, or it's just physical? What can you tell Rosa and all of us actually about this?
So the medication works in the central part. So it helps you with the desire because it just balances the hormones that inhibit and stimulates the sexual parts and the libido. So it works. It really does.
Okay, so that's interesting. And Monica was expressing her her joy. So that's what you were talking about, the spouse situation, like with the Sunday thing and all. So we actually, I think, I don't know, but I think maybe people are being shy, not daring asking question about things. So what I can tell you guys is that if you want to continue the discussion with Dr. Hernandez, you can absolutely do it. Reach out to us at hello@beautic.nyc. There's also, for the New Yorkers, there's also an exclusive offer at Smooth Synergy Cosmetical Spa. So 20% off for the first beauty customers. So if you feel like it, wait a second. I have, Rosa says, thanks, this is so informative. So maybe we have a little bit of shyness about the matter, but that's what I was saying, is that maybe talking to you would be like on a one-on-one situation could be more could be easier for people. This is, I guess, something that you see every day, right?
Yeah.
Okay. Well, thank you so much, because it was actually, like Rosa said, very informative, very global, very it was not just about medication and getting treatment. It was a very consistent presentation. So as you always do anyway. So thank you for this. If anybody needs to have any information about the treatments or the medication that Dr. Hernandez talked about, again, reach out to us. We'd be happy to send you the list and to send you also the details of Smooth Synergy Cosmetical Spa. So wait, I have one last comment too on the treatment. So so there are questions coming. How can we get the information on the treatment we want? I'm not sure. Do you understand this question exactly?
So the pills and the injections, you can ask your primary care of the OB-GYNs. In order to prescribe it, they have to be trained because of the risk for the fainting. So the physician has to be trained. The physician has to be counseling a lot. When they take the medication, they cannot have any alcohol. If they do, they have to be very careful. So you can just call your OB-GYN and ask to send you the prescription and the information.
And one question actually that I want to ask, maybe it's of interest, those treatments or medications, how long approx, so how many days, or I don't know, treatments after how many treatments can you expect to start seeing results?
So for the oral, it is about 2 weeks when the patient start feeling more increase in the libido. And with the injection, they say that about after 5 dosage, you feel increasing significant, that you want to have it and enjoy sex.
So 5. So in a span of how many? Is like once a week, once a day? How many?
It depends. It has to be at least once a day, no more than once a day, and in more than 8 per month. So you can do you can do every day for 5 days.
Okay. That's cool. He will have a question here. Is it true condoms with spermicide gel is outdated and not recommended because it dryness or irritates, I guess?
So the condoms are always going to be your first and the better way to protect yourself about STDs and contraception for pregnancy. So the spermicides, some people have a lot of irritation from the spermicides, but most of them, they don't. So it changed the pH of the vagina, so the sperm will die when you use it outside. So remember that the condom has a little bit of spermicides inside, and they kill those sperms. Sometimes the condom breaks, so then that's the reason that we ask for using spermicides in the vagina, so you can have both at the same time. But it doesn't happen all the time that it cause dryness or irritates. It could happen. Usually it's more to the latex than to the spermicides. So people are very latex allergy or intolerant, and that causes the irritation more than latex than the spermicides.
Okay. And I'm just going back to Monica, who has the question about the information of the treatment. She says, thank you. So unless we have any more questions from our audience, again, if you need more information about those treatments that Dr. Hernandez presented with, if you're in New York and willing to go visit her and, use her expertise in real, and talk to her face-to-face and consult with her, talk to us. We'll be happy to put you in touch and make sure that you're getting your 20% off as the first-time customer of the spa. Wait, we have one more comment. I knew it. No, it's just a thank you. Another one. See, you answered a lot of questions and informed a lot of people tonight. So this is great. Anything else you want to add before we let everybody go on with their day or night?
I know. I hope you all have a wonderful holidays and that we see each other soon.
Absolutely. Thank you so much, Dr. Hernandez. One more time, it was very, very cool to have you and very informative. We hope to see you again soon. Guys, have a wonderful holiday coming up. Be well and stay safe. And next week, check our schedule online, because next week we have a session with the licensed psychotherapist. It's about mental health during COVID, how to maintain mental health. That can totally go actually and help with libido. So it's very complimentary. And this is going to be another of our wonderful female experts, Dr. Erin Wiley. So come join us next week. Dr. Hernandez, sorry. This is the cute word that we use between us. Thank you again so much.
Thank you for the invitation. Have a wonderful night.
You
Bye,
too.
Bye, Stony. Bye-bye.
Bye.
Bye.